Liposuction has long been the go-to procedure for slimmer thighs and a flatter tummy, but the latest trend is using lipo to get smaller, perkier breasts.
I turned 45 and have 4 kids and just need a little mommy makeover. I've always had really big breasts. Between headaches, shoulder pain, neck pain, back pain, rashes under the breast, it's a long time coming. I have been working for Dr. Schwartz for a while now, and I've seen so many of our patients. Everybody looks beautiful, everybody is so happy. It's life-changing for me.
Today, we are going to perform my Lipo Lift procedure on Dawn. Right now, I'm going to make a small stab incision. I'm using a special machine called the POW. This allows me to remove tissue from the breast in a sculpted way. Every time I make one movement with the machine, it makes hundreds of vibrations, which allows me to perform the procedure faster as well as more precise. The liposuction portion takes the longest because I'm sculpting the breast. Right now, I'm sitting the patient up to tailor tack the breast, which means we temporarily close it to make sure they're symmetrical. Now we're removing the excess skin from the breast. We're making small incisions that allow us to reposition the nipple as well as close the breast. I am now putting in sutures to close the breast completely. And we're done.
Join us now, Dawn, along with board-certified plastic surgeon Dr. Jaime Schwartz. Welcome to you both. And Dawn?
Well, it's a good sign. You're both smiling, so that means it went well and you're a happy camper, right?
Absolutely.
Tell us about it.
It's been great. Fantastic, life-changing. I went from an FG to a D. No more headache, back pain. I had like tingling numbness in my fingers. That is gone. It's been great. Really
Dr.
great.
Schwartz, I love the procedure on the right patient.
Thank you.
So obviously, liposuction breast reduction is not for everybody. It's not necessarily new. I mean, we've been doing liposuction of the breast for years now, but adding what you did with the power-assisted liposuction, I think lends improvements to it. And I like the nuances you've added with the skin basically doing a lift after you've removed the fat, but I like the fact that in this case, you put some fat back in to improve the contours of the shoulder where the bra straps had dug in, and I would agree that you can sculpt better when you liposuction it.
The difference also as a traditional breast reduction is, you know, most breast reductions in the United States, what we do is we do something called an inferior pedicle. We leave breast tissue at the bottom. When I do this procedure, I look at the breast, and the part that people don't want is the side part and the bottom part. That's really what we sculpt, and we remove that, and then we tighten things up. The difference that we found also is when we used to, by traditional breast reduction, I was honestly opening up the whole breast, cutting tissue out, closing. I needed drains. We were worried about
with this?
no drains whatsoever.
It's less invasive, less morbidity after the procedure. You know, my only caveats is, you know, somebody with a really dense breast is going to work as well. Somebody with really giant breasts may not be your first choice. And then the issue with mammography. We know that doing liposuction in the breast, injecting fat into the breast may change mammography. And somebody who's at risk for breast cancer, real dense breast, that may be an issue, potentially a contraindication.
Yeah, and what we found also is liposuction, when you're going in and cutting out breast tissue, actually causing more scarring as we're cutting through breast tissue. That actually will separate things out and make mammography in the future a little bit harder to read. With liposuction, it's actually almost segmentally moving fat and actually leaving a lot of the breast tissue, actually most of the breast tissue behind. So when you say somebody has dense breasts, it actually will make it a little bit easier for some things. We're removing the fat for them. Most of our patients, when we talk about nipple and blood supply, almost every single one of my patients has nipple sensation after the procedure. Most didn't even have it before, so it's actually changed things that we've looked
With
at.
something like this, what is the permanency of it? Is this thought to be a one and done type of procedure?
I mean, we never like to say anything is completely one and done, but we're sculpting people's breasts and changing them. Obviously, if people have weight gain or change over time, that will change things.